chemical regulatory policy in the United States is roughly not been reviewed or renewed since the 1970s, since they were first implemented through the Toxic Substances Control Act. That Toxic Substances Control Act, which was the first regulation of its kind of chemicals in the environment, essentially permits chemicals to be approved without any requirement for testing with regard to the toxicity that it actually has in humans, let alone in laboratory studies. And so the Environmental Protection Agency is essentially given 90 days to essentially rubber stamp chemicals as they go onto market. What would really go far towards improving the lives of children and the general population at large would be a regulatory approach that actually provides at least some toxicity testing data before chemicals are approved, and a mechanism to roll back approval and actually re-examine it in light potentially of new data that suggest a potential hazard, and greater strength to by the Environmental Protection Agency in assessing these chemicals and potentially doing its own testing before a chemical is approved. What would also be really important would be a regulatory structure that actually ensures that children are, or other vulnerable populations, are given special perspective with regard to their assessment for safety. That is, if a chemical may be safe at one unit, if you will, to use a term just generically. There's a lot of terminology with regard to exposure that doesn't affect the principle that I'm getting at. And children are 10 times more vulnerable, then we should limit the exposure to 1/10 of the level that might even be found in the general population to be problematic. And we should take that perspective when we don't know the impact of a chemical and whether it's special in children or other vulnerable populations. It's that double approach that we need to take to really have a chemical reform policy that doesn't let chemicals remain innocent until proven guilty, which is the current paradigm, and unfortunately allows a natural and potentially dangerous experiment to ensue as chemicals are just placed onto market without any basic toxicity testing data. Well, let me start by actually commenting about something that worked. For pesticides, there was legislation that emerged from a National Academy of Sciences study called the Food Quality Protection Act that essentially did not assume that pesticides were innocent until proven guilty, that actually required an additional safety threshold in the absence of data for children and other developing humans that might be especially at risk. And that regulation actually led to the banning of, actually the withdrawal of chlorpyrifos, a very toxic organophosphate chemical, to be removed from widespread household use. And a study by Dr. Ricky Pereira and colleagues at Columbia University found that after the ban, the exposure to chlorpyrifos plummeted such that the chemical was not detectable in children who were born after the ban. And the association between chlorpyrifos exposure and injury to the developing brain disappeared altogether, which makes a really nice case in point to when policy can actually work to prevent disease and disability in children. If you ask, well, why have we been so slow to protect children from environmental chemicals? I would say there are multiple factors. There are strong vested interests in place that really would prefer chemicals be used on a widespread basis without safety testing. I'm not proposing, though, that we go back to the 15th century or wrap ourselves in a non-chemical bubble, if you will. But what I am arguing is that you can strike a very nice balance. You can have chemicals tested first, use them widely without potential injury. It's probably not all 80,000 chemicals that are problematic to human health and development. There probably are a smaller amount. I don't know how many there are because they're not well tested. It's probably that smaller amount that contributes heavily to the disease and disability changes and trends that we're seeing in the United States among children. And it would be that focus on the chemicals that are problematic that would allow quite a lot of relief in families who are trying to seek answers to what products to use and what products not to use, that the opposite of which we're experiencing today. The good news is that you don't need a PhD in chemistry to make your home safe. You can check your home for lead-based paint hazards. You can eat fish that are low in mercury and other chemical contaminants. You can not smoke. You can air your home out, especially when you're bringing in new products that may emit volatile organic chemicals, which are notorious for the new smell you sometimes feel in cars or in furniture or other equipment. And you can also pick safe plastics and not put plastics in the microwave, especially when there's food in there. And it's through some safe and simple steps that you can reduce your chemical exposure and improve your healthy lifestyle. It's also true that the market listens. When people go away from a particular brand because they hear of, let's say, bacterial contamination in a product, you see stocks drop. And similarly speaking, the U.S. population has a tremendous opportunity. People at large in the community, in rural America, suburban America, urban America, have tremendous power actually over what exposures they have, because they can choose healthier and safer products without having to spend a large amount more in their daily grocery bill or in their receipt at the drugstore. That can send a tremendous message. And I would also pick the example of the trend away from using BPA in a lot of baby products and frankly in everything from the sport water bottles to all uses of plastic food containers. The media attention and the intensity with which people responded in the general public had a tremendous impact on how producers changed their behavior. I would also say that people vote, and people can have a stronger voice and speak up on behalf of chemical reform. It may seem remote when you do it, but it can sometimes take just a few calls to a particular senator or representative, and whether it's in the U.S. Congress or to a state senator or representative or governor, to get things done. You'd be surprised how few people actually call and go through the trouble of doing more than sending an email or sending a fax about an issue. And there is safety in numbers as well. There are a number of websites that you can go to learn about these issues and even send somewhat pre-formatted but easy to individualize responses about issues, and that really can be extremely powerful in moving an issue forward. So I really don't think it's something that you can just throw up your hands and give up. It's something that if you really take on as an opportunity and a challenge, it doesn't take that much time to actually do something good for not just this generation, but the next generation to come. it's important to document not just the economic costs of doing something to prevent chemical exposure or prevent any chronic condition. It's important to document the benefits of doing something about that condition. I recently performed a series of analyses in which I documented that if we could reduce the percentage of children in the United States who are obese by 1%, from 16% to 15%, you could spend $2 billion a year annually. And if you achieved that, you would meet widely accepted, medically acceptable cost-effectiveness criteria. You could do that in a really cost-effective way. It seems like an ungodly amount of money to spend, but given the severe morbidity of a condition like obesity, the economic benefits are huge. And when you look at chemical exposure, the economic costs of not doing something are tremendous. Mercury pollution in the United States not only costs $8 billion a year roughly in lost economic productivity, but potentially as much as $2 billion a year due to increased cases of mental retardation. The costs of asthma are another major burden. The 4 conditions for which we know the most about environmental factors in children's health cost the U.S. $55 billion annually. That's with a B, that's not with an M. And that should be weighed very carefully along with the economic costs of doing something. Sure, it's easy to say that the coal-fired power plants have to spend billions of dollars potentially to put extra filters on to prevent mercury emissions. But when you look at that actually in a more careful way, you realize that that cost would be passed along to the consumer. And actually at an individual level, that might mean a penny or two on the average monthly electric bill. And so while it's important to talk about costs of doing things to prevent exposures, in the end you have to be careful, you have to follow the money and be careful who is actually spending the costs that would be involved. And often those costs end up coming back to the people who would benefit by preventing those health concerns from happening in the first place. And sometimes the economic benefits of not doing something don't go to the people who suffer the consequences either. So it's really important to watch from an equity perspective what might be at play as well.